Hello, and thank you for tuning in to today's segment of Chesapeake Thrives. My name is Emily Edmonds. I am the Chesapeake Thrives Coordinator, and today I would like to welcome our guest, Michelle Tryon from CHKD. Hello, Michelle.
Hello, thank you for having me.
Thank you for coming out. And today we're going to kind of focus on several priority areas. This topic really goes into our health, school-age supports, early childhood, but we're talking about parental stress today.
Yes, parental stress. So I think it's a big topic, and just recently the U.S. Surgeon General, Vivek Murthy, came out with what he called a public health advisory, and it had to do with the pressures that parents are feeling in regards to raising their children and many other aspects. But because it's an advisory from the Surgeon General, it kind of caught my attention. I've been involved with Chesapeake Thrives for a number of years now, and CHKD does offer certainly supports for parents as far as parent education and many programs that can be helpful to them. So I can tell you a little bit more about what the advisory said or how it came about. It was after 2020, they really did an extensive research analysis and data analysis and literature review on youth mental health. And as they were going around the country gathering information, they started to recognize that parents were really struggling too. And so there's certainly this reciprocal, if parents are struggling, kids are struggling. If their kids are struggling, they're struggling. And so this just came out in 2024 after the analysis and literature review of what's going on with parents, what's stressing them so much.
Yeah. Did they say what type of things contribute to that stress?
Yeah, they actually came up with 7 categories. And of course, these are going to be familiar to your listeners. I really think they will be, especially to parents. I have 3 grown children of my own, and 2 of them are parenting young children. So it's financial and economic constraints, demands, time demands, like they don't seem to have enough time for work and play and time with their children. And it has shown that over the decades that parents actually spend more time interacting with their kids, but that doesn't give them any downtime. So they're working and then they have all these time demands that come up for them. And then there's also, they're worried about their children's health, about their children's mental health and having access to quality health care, which is something, of course, that CHKD is addressing. But they also are worried about their children's safety. So school shootings, natural disasters, what's going on? There's so much uncertainty. So they are worried about the safety of their children in their communities and in their schools. They're also, social media and technology plays a part in it because parents begin to compare themselves to other parents. And of course, you're going to put something on social media when everything's looking great, right?
Right.
And so then it doesn't normalize that conversation like, oh, it doesn't seem like anybody else is struggling. And that leads to loneliness and isolation. And that was a big factor. So 48% of parents really are struggling on a day-to-day basis with their own stress levels. 61% of parents said they had a sense of isolation or loneliness. Even if they're engaged in all these different things, they feel like they're just not connecting, right? And then the last one really has to do with the culture of parenting. So this pressure to help make sure your child succeeds, that they're the best in sports, or that they get the best grades, or they're ready for college, or they have to do all these things to add to their resume. And so that culture of, am I really doing all I can for my children is putting pressure on parents. So those 7 things, you go down that list, and if you're a parent, you can probably click off most of them.
Yeah, it can be very overwhelming. Those are, some astounding statistics that you gave. What do you think are some things that we could do to help alleviate that? Like, are there any policies or resources that are available?
So the advisory, the parental pressure advisory, actually gives some recommendations, and these make sense just as well, that we need to put policies in place that provide, parental leave, especially for new parents, that they can have that time to bond with their baby, to really set that, that foundation, and affordable childcare. And of course housing and all of those social determinants of health. If families are struggling with food insecurity or housing insecurity, that certainly puts an extra burden. Also looking at the availability of mental health, and of course CHKD has a robust pediatric mental health program, and so making sure also that parents have accessibility to mental health. And part of it too, just in the day-to-day, is normalizing the conversation. It's okay to reach out for help. You are not the only one that's going through this.
Yeah, I think that's something that people often forget. When you get a little isolated yourself and that stress
Right.
wears down, you're just not aware of what's going on. And so I know CHKD has been a great partner with Chesapeake Thrives for over the years. And so what are some programs or classes that CHKD offers specifically?
Well, CHKD has a Talking Fatherhood podcast that is actually two young guys who are parenting young children. And they're great, just the way they kind of talk back and forth with each other. So it's a wonderful resource for dads. Again, just normalizing that conversation, seeing what some of their struggles, and then also looking at what are some strategies that they put into place with their own families. We also have workshops and webinars, and those happen usually about once a week, and they're free. So parents can come on, Zoom right in and get some information about child development or helping their child with stress or temper tantrums or positive discipline. We also have some Take 10. These are webinars on demand. So if you can't come at the designated time, there's 10 minutes. You can usually take 10 minutes even if you're listening in the car or something. And again, a variety of topics that are relevant to parenting children. We also have parenting handouts, and we have we call them quick tips, and we have a blog. So there's lots of resources for parents to take advantage of. The other thing is, and this is one of the places that Chesapeake Thrives comes in, we are the co-chairs. So Children's Hospital of the King's Daughters and Hampton Healthy Families have been the co-chairs of the Hampton Roads Parenting Education Network. We call it HRPEN for short, for over 20 years now. And Chesapeake Public Schools, of course, has their community outreach program. So family engagement and community outreach, their FACE people, their family engagement specialists are part of HRPEN as well. And I know they do a lot of things in Chesapeake schools to reach out to families and make that available. One of the things that HRPEN members have been looking at, and I think this is phenomenal because it addresses some of those needs, is providing these, they call them parent cafes. So families come together, there's a child minder there, so there's something going on with the kids, and the parents just have a chance to connect. So it is parent-driven as well. So the facilitated conversations that they have are with their peers, other people who are parenting and maybe struggling. And then there's also part of that HRPEN network and part of Chesapeake Thrives, I would guess, My Active Child. And so My Active Child is a resource, it's a database of all kinds of things that are going on that are family friendly in all of Hampton Roads. So we want all of Hampton Roads to thrive, and in particular, with your program, the Chesapeake residents. But one of the things that they've recently started doing is called Parent Connections. So businesses that offer programs for families, like who knows, a bounce house or or a library that does a reading program or something, that parents would come together. They would get discounted tickets if there is a price for tickets, and they would have some time to talk with other parents while their children are playing. So it's kind of a play date for parents.
Yeah, well, that's good. Well, it seems like with everything with parental stress, we're really kind of harping on the importance of accessing the community and those resources that are available through My Active Child, CHKD, and those great resources you discussed, and even just reaching out to the public school system. So thank you for coming today and talking about parental stress and all the great information with CHKD.
Well, I'm very happy to be here and share the information. We do need to take care of ourselves so we can take care of our children.
Yes, that's very important. So thank you all for tuning in to today's episode of The Thrive Show, and thank you again to Michelle Tryon from CHKD.